There's a study out today which finds liposuction is now the most popular plastic surgery procedure, beating out breast augmentation, which has held the top spot for a decade. Board-certified plastic surgeon Dr. Elliot Jacobs joining us now with what you should know since it's becoming increasingly popular. Good to have you with us this morning.
Good morning. Good to be here.
This is the #1 most requested procedure in your practice as well.
Yes, it is, certainly.
Why has it become so popular?
Liposuction is a way to contour the body, and everybody is concerned about what they look like and how they fit into clothes and so forth. So bottom line is, it's not surprising.
Not surprising to you. What is, your practice is actually fairly split, as I understand it, between men and women, which shows, too, more men are coming in. What are people asking for, especially when you look at the two different sexes?
Well, men are certainly concerned about their bodies. And that's really, in terms of liposuction, the most common thing that I do is liposuction or removal of the chest, male breast reduction, gynecomastia. We also do something called a torsoplasty, which concerns the abdomen and the love handles. That's the thing that guys hate. And lastly, the guys don't like their chins. They have a double chin and they don't like it. And so we do liposuction there in a 20-minute operation and get rid of it.
Which I never would imagine you could do that for the chin. I know for women, especially thanks to the First Lady who has these great arms that we all now obsess over our arms. That's a big area for women. Yes,
but actually the first one is the thighs. Women hate their thighs, the thigh bulges and so forth.
Yes, we do.
And the second one is the abdomen and love handles, and the arms are actually third.
Arms are third, but still up there in the top 3. So we actually have some before and after, just to give people a better idea of what this actually does when you get liposuction. This is a woman who who's in her 20s.
Correct.
She had surgery, but you only lose about 2 to 3 pounds with surgery.
That is correct. It's most people don't understand that liposuction is a way to contour the body. It's not a shortcut to weight loss. So what you're looking at here is a young lady who came in, and she was heavy. She was almost 200 pounds and wanted liposuction. Ordinarily, I would not accept her. However, she was young and she had good elasticity of the skin, and so I did liposuction on her. And then what you're seeing is a lady who became so excited after her surgery, she went on to lose a few pounds as well. And you're looking at the result 8 months later.
Right, and you point out that, again, the elasticity in her skin, which is so important because she was younger. We have the next picture we have of before and after, I think, is a woman who was in her 40s, about 45.
Yes.
What made her a good candidate?
Well, she was a candidate for liposuction, but not just liposuction alone. Because of her age, her skin would not return and tighten up as we would expect on a younger person. So what we did on her was extensive liposuction of the abdomen from below the breast to the groin, and then also a tummy tuck to tighten up the anticipated loose skin.
Finally, the before and after we have, this is someone who really is an ideal candidate. It's a male in his 20s. Why is he such a good candidate?
He is perfect because he's in his mid-20s. He's not significantly overweight. He had localized areas of fat. That's a winner. And so when we did liposuction on him, not only could we reduce the fat of the abdomen and the love handles, I also put a little line going up the middle to make him look a little more athletic.
I'm sure he didn't mind that at all.
He loved it.
So if you are thinking about this procedure, there are really some important things to consider. The first one being cost.
Well, cost will vary across the country. It'll depend upon how many areas you need to do, whether it's being done under local anesthesia, sedation anesthesia, general anesthesia, and so forth. So it'll vary all around the country. It may go from $2,000 up to $8,000.
I know you also want to make sure that the doctors are board certified. You say visit a couple of different doctors too to make sure that you really know what you're getting. I do want to get to, before we let you go, the do's and don'ts, because I think these are really important things for people to consider as well.
Yes.
Run through those for us.
Okay, do's. Keep your skin healthy. Be in good shape going into surgery. Don't smoke. Don't expose your skin to the sun. We want healthy skin as opposed to lax skin. That's #1. #2, keep a stable weight. Be realistic in what we can do for you. Speak to your doctor and know exactly what we can do. And most important, do your homework in terms of researching your doctor. Visit several doctors to get different opinions. Make sure they're board certified. If they're going to be doing work in an office, make sure they are credentialed in that same procedure in the hospital.
Ah, really important.
Very important.
And give me then your top 3 don'ts.
Okay. #1, don't think that this is going to be weight loss. We brought these peanuts here to show you. Fat is very bulky, but it's light. So when we do liposuction, we're not removing weight. We are removing contour. Okay?
So really only 2 to 3 pounds from liposuction is what you're going to lose. All important things to consider. Doctor, thanks for being with us this morning.
Well, thank you very much.